Have you ever had a little urine just leak out after you finish going to the bathroom? Well, I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk all about post-void dribble, also known as after-dribble. Now, post-void dribble is essentially the involuntary leakage of urine that occurs after you finish going to the bathroom. For men, it's often when they walk away from the toilet, or for women, when they stand up from the toilet, they may notice a little bit of dribble. Now, this is a really understudied area, and we know that about somewhere between 8% to 63% of men experience post-void dribble. And in fact, in men who have issues after urination, this is the most common complaint, with over half of men complaining of dribbling urine after they finish urinating. So what causes this? Now, the most common cause of this is usually an enlarged prostate. So the prostate is a walnut-shaped organ that sits underneath the bladder and around the urethra. And as it enlarges, it can narrow the urethra. And this can cause urine to get trapped behind the prostate that doesn't all come out easily when you urinate. And so this can lead to a little urine slowly dribbling out into the urethra and then later dribbling out after you finish the stream. The second cause is sort of related, but it could be a narrowing elsewhere in the urethra. So if you have a narrowing somewhere, again, this can cause trapping of urine behind that narrowing that can then dribble out after the urine stream. Now, the other theory of why this happens is really unknown. And the thought is that maybe the muscles surrounding the urethra have gotten weak due to age, or that there's been neurologic changes, or what we call neuromuscular changes in those muscles, making them less effective at expelling urine or pushing it out of the urethra and emptying completely. Now, I've talked about post-void dribble or after dribble previously on a video, but I wanted to make this video because a systematic review was recently completed, and they looked at all the studies about post-void dribble up until June 2023. And essentially, they wanted to look at men who had post-micturition dribble or post-void dribble and see if they offered a treatment option and how effective it was. And when they did a search of all these studies, they found 4 randomized controlled trials are essentially trials where they have a treatment group and a placebo group, meaning a group that either gets nothing or gets a fake treatment to compare the efficacy of the two. Now, of these 4 articles, 2 did something called pelvic floor muscle exercises, and 2 offered treatment with a medication called a PDE5 inhibitor, which is also used for erectile dysfunction. Now, the pelvic floor muscle exercises are in theory strengthening those muscles around the urethra to help expel urine better so you don't have that dribble. Now, the first study had 3 groups. One was a control group where they gave some information about lifestyle modification. The second group had pelvic floor muscle exercises, and the third group had something called urethral milking. And this was done in Australia, and each group had about 15 people. And they followed these people for about 13 weeks. Now, in these pelvic floor muscle exercise groups, they basically went through different strength training exercises to increase the strength of the pelvic floor. They also made sure that they did both fast twitch and slow twitch muscle fiber exercises, and they assessed their improvement over time and followed these patients for about 13 weeks. Now remember, there was a third group that did urethral milking. Now, what is urethral milking? Well, it's essentially putting your fingers, 2 fingers, in the perineum underneath the scrotum and pushing towards the base of the penis to help milk out any urine that might be in the urethra, because the urethra is not only in the penis but also goes down into the perineum, or also known as the taint, the area between the scrotum and the anus. Now, essentially, people recommend doing this after urination to help get out any remnant urine. Now, the other group was done in the UK and very similarly was ascribed to pelvic floor muscle exercises compared to just normal lifestyle changes. So in that first study in Australia, they measured pad weight. So they actually had them wear a pad and they measured how much urine leaked out in the pad for a period of 4 hours before the intervention and then after. And what they saw was that those in the control group had no change in the leakage. Those in the pelvic floor muscle exercises saw a decrease in about 4.7 grams less than what they had at baseline. And the urethral milking group also saw a decrease, although it was a little bit less. It was about 2.9 grams less on the pad weights. Now, the other study that was done in the UK that was just lifestyle changes compared to pelvic floor muscle exercises, they didn't measure pad weights, but they asked patients, did you have any post-micturition dribble at 6 months? And what they found was that about 75% of people in the pelvic floor muscle exercise group had improvement at 6 months, whereas the lifestyle change group had no change. Now, the other two studies looked at giving either a low dose of tadalafil, 5 milligrams every day, or udenafil, which is another PDE5 inhibitor, which is not available in the United States, daily as well to patients who had post-micturition dribble. Now, they studied these patients using a standardized questionnaire that's used for post-micturition dribble. Now, there's only one questionnaire. It's got about 5 questions, and it's only validated in a few countries. But they use this questionnaire to assess if there was improvement as well as pad weights. Now, one of these studies measured pad weight by the volume or the amount of milliliters of leakage of 1 minute after voiding. The other one used a folded up paper towel in the underwear and measured how many grids got wet. So these are not exactly perfect measures, and so there are some limitations, but they both saw a significant decrease in post-micturition dribble. Now, does this significant decrease actually translate to a meaningful clinical improvement is hard to say. Now, the urethra corpora cavernosa reflex is essentially when urination occurs, it causes the corpora cavernosa to relax and also causes the ischiocavernosus muscles to contract. And this can then allow for more active emptying of the urethra. And this is because the muscles are contracting, but also the relaxation of the corpora allows the urethra to get a little bit more relaxed and maybe wider potentially to let urine flow even better. Now, ultimately, these are small studies. Again, most of them were less than 60 people. And again, there was definitely some limitations in the studies based on how they measured things and were these actually clinically significant. But ultimately, what can you do if you're struggling with post-void dribble? Well, first and foremost, you can easily try urethral milking, meaning putting gentle pressure in the perineum or the space between the scrotum and the anus and pushing forward towards the base of the penis to see if that will help milk out the urine. That's easy to do, may help you, and you might not have any issues at all. The next thing you want to do is make sure you see a urologist to get assessed for if you have an enlarged prostate or a urethral narrowing. Now, these can be very well treated by a variety of things. And if you want to learn more about them, check out my videos on enlarged prostate or urethral stricture, where I talk about how Johnny Knoxville had a urethral stricture. And so you can learn a little bit about that. But essentially, these are very treatable things that can really improve your quality of life if you're having issues with dribbling urine. Now, the next thing you could do is try to do pelvic floor muscle exercises. Now, these essentially are exercises to strengthen the pelvic floor. These are things like Kegel exercises, where essentially it's sort of the feeling like when you stop urine from flowing. So if you're peeing and you tried to stop the flow, you are actually using those pelvic floor muscles to contract. Now, you don't want to make a habit of doing this while you urinate. So other things you can think of is trying to lift your penis up without touching it, or feeling like you're trying to hold in a fart, but you don't want to be squeezing your abdominal muscles or your gluteal muscles. So sometimes this requires that you learn how to do this with a pelvic floor physical therapist. Now, thank God for YouTube, because there's lots of pelvic floor physical therapists on here who are teaching you how to do Kegel exercises if you don't have access to one. Also, if you start having pain after doing these exercises, now that could be pain at baseline or pain with ejaculation or erection, or you start noticing that there are more changes in your urine or your bowel movements or maybe your back, stop the exercise and come see a urologist to get evaluated, because you could be tensing up your pelvic floor too much and not relaxing enough, leading to dysfunction. Okay, well, I hope you guys found this video extremely helpful. And if you missed it, I wanted to let you know that we are seeing patients now in Beverly Hills as well as Newport Beach, California. So feel free to make an appointment at www.renamalikmd.com/appointments. And if you enjoyed this video, please be sure to share this channel with your friends and check out my recent video on preventing enlarged prostate or preventing BPH. Now, as always, remember to take care of yourself because you are worth it.